Okay, we're just going to give it a couple more minutes to allow people to join, and then we'll start at 6:30. Okay, so it's 6:30. Thank you everyone for joining us. And welcome to today's webinar on being active after total laryngectomy. My name is Daniela Esteves and I am the UK lead nurse at Atos Medical. The presenter for today is Alison Dempster, who is one of our speech and language therapists and clinical educator at Atos Medical UK. Very quickly, and just to get through some formalities, please be aware that providing a virtual forum for this discussion, Atos Medical is not providing medical advice. The answers provided are not guidelines or endorsements. The presentation and the Q&A will be recorded with permission. We will start with a presentation from Alison, who has extensive clinical experience working in the NHS with laryngectomy patients as a specialist ENT speech and language therapist. Today's webinar is the third of a three-part educational webinars. And during this webinar, we will present responses from 1,800 laryngectomized patients worldwide to better understand their issues with returning to physical activity after their surgery. Alison will present research on factors impacting this, and we will discuss potential solutions and improvements as well. If you have any questions throughout our presentation, please use the Q&A function and we will take time to answer them at the end. I will be moderating and keeping an eye on the questions that come in via the Q&A. Alison, over to you.
Okay, thanks very much, Daniela, and welcome to everybody. Within the webinar this evening, we'll be addressing three areas. Firstly, we will focus on what patients experience when they try to live an active life after total laryngectomy. Next, we will consider the factors that impact the ability of patients to be physically active. And finally, we will address considerations for supporting patients to live a more active life. So what do patients experience when they try to live an active life after laryngectomy? Well, in 2015, the Red Associates, which is a global anthropology and sociology consulting company, conducted a study in collaboration with the Netherlands Cancer Institute and Atos Medical. It's been the largest study of its kind carried out and lasted until 2018. So the aim of the study was to better understand where to improve laryngectomy care and quality of life for patients by understanding both patients' and professionals' everyday lives. The Red Associates conducted observations and interviews on 26 patients. They spent 1 or 2 days in the patients' homes, as well as in 9 hospitals, and with over 50 healthcare professionals. The study was conducted in 4 countries, the US, the UK, France, and the Netherlands. And after examining a range of activities carried out by patients and professionals, the study revealed that the main challenges were finding easy solutions for every stoma in every situation and helping patients to get back to an active lifestyle. In 2018, the Red Associates conducted research to obtain insights into laryngectomy patients' experiences in their daily lives. The survey was sent to 8,184 patients, with 21% of patients responding. It involved 9 countries and used multiple choice questions covering demographics, everyday pulmonary, communicative and aesthetic issues, as well as the situational issues related to activity, the environment and sleep. So the participating patients were screened to represent a spread in demographics, time since surgery and product use. And we can see from the bar chart the number of patients from each country who took part in the study, with the United States having the most participants. So the qualitative research from the study showed that patients experienced shortness of breath when trying to be active after laryngectomy. So let's meet Arthur on the left of the screen. Arthur has experienced difficulties when running short distances and walking up the stairs, even when wearing an HME. To quote Arthur, he says, "It just feels like I get no air, my lungs feel empty." He's very aware that carrying out basic activities like walking upstairs is becoming a daily challenge, so he tries not to walk very far and will only really walk to a neighbour's house. We have Martin in the middle, whose job involves binding chimneys to pallets. But when he does this, he becomes exhausted very quickly, and that makes him angry and frustrated because, as he says, it's easy work. Martin also has to take out his HME so that he can breathe better and more deeply when he's exerting himself. The final gentleman, Otto, on the right, pulls out the foam of his HME during physical activities, such as riding his bike. He believes that this helps his breathing, and he keeps the HME button in place because it's more hygienic to occlude his stoma rather than using his finger. So we can therefore see that shortness of breath is a common problem after laryngectomy when patients try to carry out daily living and working activities. And patients perceive increased air resistance when wearing HMEs. As a result, they restrict their activities, this having a direct impact on their leisure and work pursuits, with possible financial implications due to being unable to carry out their jobs. So just thinking a bit more about breathing during physical activities. Patients in the study reported that they needed more air intake and to breathe deeper and better during physical activities like walking the dog. So Eric on the left says, "I would really like to be able to get back to doing my yoga." Eric wears an extra flow HME, giving him maximum breathability. Vanessa in the centre can no longer be physically active even when using extra moist and extra flow HMEs. She says, "My world has become smaller for me. I don't socialise much. I spend most days at home with my mum." Alba on the right tries to stay as active as possible. She and her husband actually ride Harleys, but she struggles to carry out other activities such as hiking and walking because she has trouble getting enough air with her HME on. It's very apparent how restricted these patients' lives actually are, and you can imagine the impact of this on their mental health and well-being. Patients who took part in the study reported that in order to be more active, there were 2 main things they felt they needed. The first thing they felt they needed was more oxygen, as they needed to stop to take breaks or take off the HME when being active. Otherwise, they gave up on the activity entirely due to shortness of breath. The second thing they needed was more confidence to try physical activities, and that they felt they would really benefit from being encouraged to try more activities. But out of fear of failure, they simply didn't, or they gave up too easily. Quantitative patient research confirms these issues that I've just addressed, and we can see from the bar chart that 64% of patients reported becoming short of breath while running, exercising, playing sports or dancing. 56% said they become short of breath while doing chores, housework or manual labour, and 51% reported having taken off the HME to catch their breath. So the qualitative and quantitative research revealed the same issues that patients experience when they try to be active. Also emerging from the RED Associate study was information regarding levels of trust that patients have in their clinicians. Patients were asked who they trust to provide advice on stoma care, and it emerged that despite having the highest degree of trust in their clinicians for advice, patients tended not to discuss with them problems they experienced during physical activities. The chart on the left shows who patients trust to provide advice on stoma care. 71% said it was their doctor or surgeon, 56% reported it was their clinician. I might just add that this chart relates to patients in the US, and in fact, in the UK, 81% of patients reported that they had a high degree of trust in their clinician for advice. And this may certainly relate to the substantial and close contact that patients in the UK have with their clinicians, including seeing them regularly for voice prosthesis changes. The chart on the right shows what patients spoke to their clinicians about in the past year. So 39% of patients said that yes, they told their clinicians about coming short of breath when exercising or doing a moderate physical activity. 53% did not speak to their clinician about their shortness of breath. 29% spoke about irritation in their windpipe from the air. 60% did not speak about it. And 33% spoke to their clinician about activities they couldn't do but would like to do. 58% did not speak about this to their clinician. So we can therefore see that the majority of patients are not speaking to their clinicians about their issues, despite trusting and valuing their advice. Clinicians may therefore be unaware of the types of difficulties that patients are experiencing when they try to exercise. The next slide illustrates the results of a study by Lehman's earlier this year that came from the RED Associate study, which conducted quality of life questionnaires on 1,705 laryngectomy patients across 9 countries. The questions that patients were asked focused on quality of life and 7 issue themes, including pulmonary issues, avoidance of social situations, limitations in daily activities, sleeping problems, feeling vulnerable due to environmental factors, issues with aesthetics, and communication issues. The limitations in daily activities and avoiding social activities that emerged from the study were associated with decrements in respondents' quality of life. The theme pulmonary issues had a strong correlation with most other themes and was key in most other reported issues. Therefore, pulmonary issues might be an underlying cause of many other issues, including experience limitations in daily activities and avoiding social activities. It emerged from the study that patients who were less than 2 years since their laryngectomy and less than 60 years old, especially if they were female, reported lower quality of life scores. The authors stressed that in order to improve clinical practice, it's recommended to adequately prepare and monitor patients regarding their participation in social activities, meaningful activities, and pulmonary issues to enhance their quality of life. When considering public health exercise guidelines, a study by Rogers concluded that the majority of head and neck cancer survivors do not meet current public health guidelines on exercise. So in this study, head and neck cancer patients completed a self-administered survey. 59 patients participated, the mean age was 58 years, and 28% of patients previously had laryngeal cancer. Rogers wanted to examine exercise in relation to quality of life, fatigue, and depression. The study compared exercise before diagnosis and after diagnosis. And what emerged was interesting, but maybe not surprising. So results showed that only 8.5% of patients met the current public health exercise guidelines of 150 minutes moderate exercise per week, or 75 minutes vigorous exercise per week. Over half of patients were in fact completely sedentary. This obviously having huge impacts on physical and mental health. The study also highlighted meaningful and potentially beneficial associations between the amount of exercise in minutes undertaken, quality of life, and fatigue. We can see from the chart just how much exercise has reduced after diagnosis of head and neck cancer compared to pre-diagnosis. This again highlights the potential effects of lack of exercise on physical and mental status for these patients. So we've seen that head and neck cancer patients report less physical activity post-treatment, even although higher levels of activity are associated with higher quality of life scores. Summit in 2016 conducted a survey of 172 head and neck cancer patients pre and post-treatment. He wanted to determine the prevalence of physical activity in these patients pre and post-treatment and the associations with quality of life. So 19% of the patients had cancer of the larynx. Of all the patients who completed the questionnaire, 71% reported less physical activity post-treatment. Actually, higher levels of physical activity post-treatment were associated with higher quality of life. In addition to head and neck cancer patients being less physically active after diagnosis and treatment, more recent studies have demonstrated that the ongoing COVID-19 pandemic has led to decreased levels of physical activity in general, this also impacting on health and quality of life. So Oni et al. This year highlighted that the implementation of measures to prevent further spread of COVID-19 may lead to increased physical inactivity. It was concluded from that study that safe outdoor activity should be encouraged, for example, walking and biking. Slimani this year also examined the relationship between physical activity and quality of life during COVID-19. There were 3 groups of patients who did varying amounts of exercise. From this, it was highlighted that inactive subjects had the lowest quality of life scores. Finally, Jacob, again this year, investigated the association between physical activity and mental health. 902 subjects were analysed, and it was concluded that those not doing moderate to vigorous exercise had poor mental health, with the more active subjects showing better overall mental health during the implementation of COVID-19 measures. Again, it's clear that the impact of COVID-19 measures may reduce the physical activity of laryngectomy patients even further than they're already reduced by the impact of the laryngectomy itself. Di Sebastiano, again this year, examined physical activity changes in 2,338 subjects as a result of the COVID-19 pandemic. Di Sebastiano wanted to determine changes in physical activity of the subjects between 4 weeks before the pandemic and 6 weeks after the pandemic. Subjects wore fitness trackers and used health apps to record moderate to vigorous physical activity, as well as light physical activity, along with the number of steps taken. It was revealed, perhaps not surprisingly, that immediately after the pandemic declaration, there was a significant decline in moderate to vigorous activity and in light physical activity and in the number of steps taken. Moderate to vigorous physical activity levels returned to pre-pandemic levels by 6 weeks. On the other hand, light physical activity and steps taken showed a significant and sustained decline. So no increase in these activity levels were seen 6 weeks after the pandemic being declared. This is illustrated on the bar chart. It was concluded that this may have significant long-term implications for the physical and mental health of these individuals whose light physical activity levels and steps decreased. So moving on, we're now going to address the factors which impact the ability of patients to be physically active. So considering the effects of physical exercise on health-related quality of life in cancer patients, Mishra in 2012 conducted a systematic Cochrane review on randomised controlled trials, which included 56 studies and 4,826 cancer patients. The authors evaluated the effects of exercise on overall and specific health-related quality of life amongst adult patients with cancer during active treatment. It was concluded that exercise may have beneficial effects on health-related quality of life and on certain health-related quality of life domains, including physical functioning, role functioning, social functioning, and fatigue. In addition, it was established that the positive effects of exercise interventions are more pronounced with a moderate or vigorous intensity as opposed to mild intensity programs. So patients who are able to maintain moderate levels of activity during treatment will gain benefits across many areas of their lives. Samet et al. In 2014 conducted a literature review which included 8 studies with 260 head and neck cancer patients, 66 of them being laryngectomy patients. The associated exercise for cancer patients with a 41% reduction in mortality and highlighted that exercise may play an important role in the quality of life of head and neck cancer patients. It was concluded that exercise may improve functional well-being and fatigue, which are predominantly difficult issues for head and neck cancer patients. Systematic review shows that physical activity has many health benefits in cancer survivors. In 2010, SPEC conducted systematic quantitative review and meta-analysis using 82 studies, which examined physical activity interventions during and after cancer treatment. The results for physical activity interventions post-treatment showed a large effect on upper and lower body strength, moderate effects on fatigue, small to moderate effects on physical activity level, aerobic fitness, overall quality of life, IGF-1 hormone, which promotes cell growth and symptoms and side effects. So exercise was well tolerated both during and post-treatment without adverse events, with the exception of a few patients. So in summary, physical activity during and post-cancer treatment has a positive effect on health outcomes in cancer patients. Bunzel in 2016 demonstrated that physical activity is beneficial after laryngectomy and that special training programs should be developed for these patients. In his study, 16 laryngectomised patients received aquatic therapy treatment with emergency training included. 56 patients were included in the study, and Bunzel wanted to describe the role of rehabilitation sport for laryngectomised patients. 94% of patients who took part in the aquatic therapy reported improved shoulder and neck pain. 88% reported having feelings of fun and power, and 75% felt they had improved social contact. It's clear to see how improvements in these areas would have a positive effect on mental health and well-being. It was concluded from the study that sports are favourable for patients after laryngectomy, and that again, special training programs should be developed and included in rehabilitation after laryngeal cancer. Let's now have a look at the physical activity and clinical guidelines for cancer survivors. The American Cancer Society Head and Neck Cancer Survivorship Care Guidelines 2016 recommends that primary care clinicians counsel head and neck cancer survivors to engage in regular physical activity consistent with their Cancer Society guidelines, and should specifically focus on avoiding inactivity with the return to normal daily activities as soon as possible after diagnosis. The Society recommends that patients should aim for at least 150 minutes of moderate or 75 minutes of vigorous aerobic exercise per week, and that these exercises should include strength training at least 2 days per week. A consensus statement from the International Multidisciplinary Roundtable states that exercise training and testing are generally safe for cancer survivors and that every cancer survivor should avoid inactivity. The statement highlights that aerobic and combined aerobic plus resistance training or resistance training alone could improve common cancer-related health outcomes such as anxiety, depressive symptoms, fatigue, physical functioning, and health-related quality of life. So let's now consider the anatomy of the respiratory system. We'll start with looking at the normal anatomy in a healthy individual. So air enters the body via the oral or nasal cavity, moves through the oropharynx or nasopharynx before bypassing the epiglottis and into the larynx. We can see on the diagram on the left the oral and nasal cavities, the vocal folds, and the thyroid cartilage in front of them. Then we have the cricoid cartilage, which is an entire ring of cartilage. Then the tracheal rings, which are horseshoe shaped. Below the thyroid cartilage, wrapped around the front of the trachea, is the thyroid gland, which is shaped a bit like a butterfly, with the isthmus connecting both lobes. The isthmus generally covers a few of the highest tracheal rings. So at the level of the carina, the trachea splits into the right and left main primary bronchi, one for each lung. The main bronchi are then divided further into smaller bronchi and then into bronchioles with alveoli at the end. So below the lungs is the diaphragm, and this is a very important muscle for breathing. An important anatomical division is that of the upper and lower respiratory systems or airways. So the nasal and oral cavities, the pharynx and the larynx, are generally considered the upper airway. The trachea, bronchi and lungs are considered the lower airway. So after laryngectomy, the upper airways are not functional anymore for the pulmonary system. And we can see from the diagrams that before laryngectomy, the airflow needed can be adjusted by altering nose and mouth breathing, with airways expanding to lower breathing resistance when more oxygen is needed. After laryngectomy, however, breathing through an HME does not allow for adjustable changes in airflow resistance. So in other words, the airflow resistance is constant when breathing through an HME and doesn't change according to airflow needs brought about by increased physical activity. In normal breathing, during low activity levels, nasal breathing provides a degree of resistance, this resulting in increased gas exchange. So in other words, more oxygen is inhaled and more carbon dioxide is exhaled. During high activity levels in normal breathing, there is a significant increase in nasal volume, and nose breathing resistance has been shown to drop by 30% during intense physical exercise. Also, pre-laryngectomy, mouth breathing is able to complement nasal breathing. Post-laryngectomy breathing through an HME has a positive effect on pulmonary health as it leads to higher air resistance and increased tidal volume. Breathing through an open stoma, however, means that there is decreased breathing resistance, this leading to reduced transpulmonary pressure. This then increases the potential for the alveoli to collapse and hence lead to a reduction in tidal volume. Breathing in unconditioned air, so air that's cold and dry, has a negative effect on cilia and pulmonary health. And breathing through an open stoma without an HME can result in increased coughing, mucus, forced expectorations, and chest infections. So hugely beneficial to patients to wear HMEs 24/7 post-laryngectomy for maximum lung health. So staying on the topic of HMEs, beneficial as they are, HMEs are not designed for strenuous exercise. And therefore, this can lead to patients removing them during activities when they find they cannot breathe properly, as we found out from the patients at the start of the presentation. Several studies have looked at HME use when exercising. Jones in '97 reported that 80% of patients found that HME comfortable from a breathing point of view when resting, but 51% of these patients found it uncomfortable during exercise because of the higher breathing resistance. Ackerstaff in 1998 found that 37% of patients experienced an increased airway resistance when wearing HMEs, but this did not lead to them discontinuing HME use. A few patients in this study reported that they periodically removed the HME during strenuous exercise. Lastly, Brooke in 2013 investigated long-term use of HMEs and concluded that some patients don't use an HME due to adhesives irritating their skin, not using them at night, and not wearing them during physical activities. 45% of patients who didn't wear HMEs wore nothing else over the stoma. we can imagine some of the repercussions for these patients with open stomas, especially when outdoors, whereby any material can simply enter their airway, including pollen, grass, dirt, and even insects. So clinical evidence has therefore highlighted some of the shortfalls of HMEs. Let's now consider how we can help patients to live a more active life, given the positive effects on health, the reduction in mortality, and improved quality of life that regular exercise can provide. Now, there are a few patients whose situations we will discuss, and I'm going to bring in Daniela Estevez, who is our lead head and neck nurse here at ATOS Medical, and she will address these patient issues. So firstly, Daniela, if I can present David. David is a gentleman who has stopped golfing because he couldn't breathe easily with all the pollen and dust in the air when on the golf course. Is there any advice you could give to David to make his breathing better and get him back out onto the golf course?
Hi again. So the first question for David would be, what is his routine in terms of protecting his lungs? Does he use a HME? We could start by explaining to David that ideally, when he is out golfing, he should try a HME that would provide filtering for dust and pollen, for example, the Provox Micron. And then we could set up a plan with him on how to get there. How can we make his breathing better so he can enjoy playing golf again? So if he does not use a HME at all, we should start with a HME with low breathing resistance, for example, the extra flow, and start with small periods, increase the amount of time using the HME and the activity levels whilst using it. And we should also track his progress. So if we see progress on the amount of hours he's able to use the HME for, or the amount of things that you can do whilst he's got the HME on, David will stay motivated and he will see he's closer to achieving his goal, which is ultimately playing golf without trouble breathing. So ideally, we would like David to be able to be active and to be able to tolerate breathing exercises with using HME with a higher breathing resistance, such as the extra moist. Actually, the extra moist and the Provox Micron have the same breathing resistance. So if he's able to be at home doing breathing exercises, deep breathing, and if he's able to go up the stairs whilst using the extra moist, he would be more likely to tolerate using the Micron when he's out in the field golfing. So this is something we can work on if David already uses HMEs as well. So to work on using the extra moist, doing deep central breathing exercises at home will condition him to be able to tolerate the Micron. And it is important as well that David understands the situational use of HMEs and selects the adequate HME for each activity, because as you mentioned earlier, people with intact upper airways can switch between nose and mouth breathing, depending on their activity level and the need for more air or oxygen intake. The laryngectomized patients cannot. So it's important that David understands the differences between the HMEs available and uses the appropriate one, and hopefully achieve that 24-hour HME use compliance you were talking about, that which, according to the available evidence, will have the best impact in minimizing pulmonary complaints and achieving a better quality of life for him.
Great, Daniela, thanks very much for that. Our second patient is Vanessa. We met Vanessa earlier. She feels isolated at home and is increasingly afraid to go out due to the COVID-19 pandemic. She said, "My world has become smaller for me. I don't socialise as much anymore and spend most days at home with my mum." So Daniela, any advice for Vanessa?
I think at some point, everyone has felt a little bit like that throughout the last 6 to 8 months. But in Vanessa's case, I think her main issue seems to be confidence, to be able to go out. So I think having a structured plan of how she can protect herself when she goes out would be helpful. In summary, she should follow the same guidance as everyone else. Face coverings, hand hygiene, social distancing are key. And again, finding out what is Vanessa's routine, that we could help incorporate added protection from when she leaves the house. If she uses HME at home, then we could switch that for a Provox Micron and then a stoma protector, as well as a face covering. And again, in order to build that confidence, we should start with something small, like meeting one friend for half an hour at a local park, somewhere she's comfortable with, not for too long, and to have an established method of that she would follow. What she would wear when she goes out, what does she do when she re-enters the house, remove the bib, the mask, the HME, wash her hands, apply clean ones. And I think once she's done that once, and once she's had that social interaction, and once she's left the house, she will be more confident to do it again, and this will have a positive impact, of course, in her mental health. And again, being mindful of hand hygiene, as well as removing everything as soon as she gets home, is also highly important. And giving her a little bit of reassurance. You know, a normal person with an intact upper airway wouldn't have the protection of a viral filter in front of their airway, and she would. So it's just that reassurance and giving her the confidence to do this.
Great advice. Thanks so much, Daniela. Before we discuss our third and final gentleman, I just wanted to speak a bit more about HMEs and how they actually function. So currently there's a trade-off situation in HME functioning with respect to breathing resistance and humidification. If we have an HME with higher humidification, that same HME will have increased breathing resistance, so lower breathability. Now, this is due to the foam in the HME being more dense with smaller pores to trap more water. And as a result of that increased density, the breathing resistance is higher. On the other hand, if the HME breathing resistance is lower, so increased breathability, the humidification will be lower. Now, this is due to the foam in the HME being less dense and having larger pores. And this reduces breathing resistance, but cannot hold as much water. So when it comes to breathing resistance and humidification, if we have more of one, we have less of the other. If we consider the Provox Extra Moist, it has a high humidification level, but increased breathing resistance. The Extra Flow, however, has reduced breathing resistance, making it easier to breathe through, but with less humidification. And we can see the differences in foam density on the image, with the Extra Moist on the left being more dense, and the Extra Flow on the right less dense. In an ideal world, patients would have an HME with both low breathing resistance and high humidification. A larger HME with an increased diameter could perhaps provide that decreased breathing resistance and increased humidification. So we know that development and improvements in HMEs are required. Although they're hugely beneficial for many patients, they don't work for all patients in all situations. So returning to Arthur. Arthur has a hard time running short distances and walking up the stairs with an HME. Daniela, any advice you can give Arthur at all?
I think I've seen quite a few Arthurs in whilst working with laryngectomized patients. I think things that have worked from my clinical experience, I've been working on pulmonary rehabilitation, and then what we mentioned earlier, deep central breathing exercises, understanding the differences between the different HMEs. I think that image of the different foams is quite important. This is something I use when I do home visits with patients. I show them both HMEs and I ask them, do you see any difference? And once they spot the difference in the density of the foam, I'll then explain one will allow for more airflow, the other one will retain more moisture. And when you breathe through one, you will notice something that is different from when you breathe through the other. And that ability to breathe with different HMEs will be important in choosing a HME for each situation. So HME that will work when the patient is at rest, it won't work for when the patient is got to run short distances or go up the stairs. So in Arthur's case, and many of my patients, they might still need to remove the HME to catch their breath, as many patients have other health complaints such as COPD, which will make them feel short of breath easily. But it's important that even if they have to remove their HME, once they catch their breath, they put it straight back on. And it's also important to take into account if it is a crowded place, especially in the COVID-19 scenario, or if the weather is too cold, or if it's pollen season, it might actually be detrimental for the patient to remove their HME. And you're right, we often compromise breathability for humidification and the other way around. And this is something that is important for patients to understand. So that work on their pulmonary rehabilitation when they're at home and they're at rest, and they can work on deep breathing exercises so their lungs are more conditioned for when they need that deeper breath, when they do some sort of exercise, I think would be the main thing to focus on.
Okay, lovely, thank you. We can see from the HME comparison chart the trade-off between humidification and breathing resistance for the various Provox HMEs. Incidentally, humidification is measured as moisture loss in milligrams per litre, and breathing resistance is measured in pressure drop in hectopascals. As the chart illustrates, when humidification is higher, breathing resistance is higher, as can be seen in the case of the extra moist. When humidification is lower, breathing resistance is lower in the case of the extra flow. So according to the World Health Organization, there are ways we can help patients to become more physically active. This includes use of a schedule with built-in routines, making exercise part of the daily routine and carrying it out at the same time every day. The organisation also advises that a patient strives for 150 minutes of moderate activity per week, and walking or cycling would be an example of moderate exercise. It's also recommended that patients set realistic goals, building up slowly and get used to the breathing resistance during the exercise. It's suggested that activities are planned with family or friends, and even use a gym or club or physiotherapist as a way of achieving exercise goals. Selecting the correct adhesive in HME is essential. So for example, wearing an HME with a lower breathing resistance, such as the Provox Extra Flow, and if patients use Provox Freehands, switching to using the cap over the Freehands Flow HME instead of the Freehands attachment may be of benefit to lower breathing resistance and prevent accidental occlusion as well. So the cap can, of course, still be occluded to speak. When it comes to HMEs, patients may need help to select the right HME for certain activities. For daytime wear, higher intensity activities will require HMEs with better breathability. The patient can be encouraged to think about their various situations throughout the day, and an important consideration is whether they use Freehands or not. If they do, and they're carrying out moderate activities such as golfing, the Provox Freehands HME Flow would be advised, with Freehands Extra Moist being advised for low-level activities. If a patient doesn't wear Freehands and is engaging in low levels of activity, then they may be suited to the Extra Moist. For moderate activity levels such as cycling, the Extra Flow would be recommended. And if the patient wishes to have extra protection, for example, when gardening or going in public transport, the Micron HME with its high filtration of dust, pollen, particulate matter, as well as bacteria and viruses would be an excellent choice. So that is daytime. Overnight, it's recommended that patients wear Provox Luna with its high humidification levels and its cooling, soothing base plate, perfect for giving the skin a break from the daytime base plates. So to summarise, there's a clear need to help patients live a more active life to improve their quality of life following total laryngectomy. The Red Associates study has shown that patients want to get their lives back and enjoy the activities they pursued before surgery. We've seen that this, however, is limited by breathing capacity post-surgery. And if we recall, 51% of patients reported that they had to remove their HMEs to catch their breath. And 45% have felt irritation in their windpipe from dry air or air particles. We've discussed how these issues are caused by the physiological changes in breathing resistance and filtration when air bypasses the upper airways after surgery. A possible solution to patients' problems could be to use an HME with lower breathing resistance when active, and an HME combined with an electrostatic filter when in need of extra protection. Although the current HMEs that we have to choose from are hugely beneficial to lung health, when patients are engaging in higher activity levels, they're not always providing good enough breathability. Just a concluding remark about physical activity. It's known to be hugely important for health and quality of life, and this area could be addressed with patients pre and post-op. Thank you so much for listening. I hope the information presented has been informative and beneficial, and we now welcome any questions. Thank you.
We've actually got a couple of live questions as well as questions that have been submitted previously. And a couple of them are actually very similar. So we've had quite a few questions submitted about COVID-19, and we can kind of combine them, Alison, if that's okay. One of them is, what is the advice for laryngectomy patients going out during the COVID-19 pandemic? And is there evidence-based guidance on whether laryngectomy patients should wear face coverings? And during COVID-19, is it better for patients to wear free hands so they're not touching their stoma area when speaking? And what about touching the micron? Sorry, it's a long question, but if you missed, I'll just recap, Alison.
Okay, I'll try my best to answer that. So the same advice applies to laryngectomy patients as the advice applied to everyone, which is regular hand washing or using hand gels, social distancing, and wearing face coverings, as laryngectomy patients can still spread the virus via their nose and mouth, and they can still be exposed to the virus via their nose and mouth. So we would recommend that a patient wears their HME. They may choose to wear an additional covering and also a mask over their stoma area as well. In terms of using the micron, it's obviously extremely beneficial in filtering bacteria and viruses due to the electrostatic filter. And I think patients can still use the micron during COVID-19 and place a mask or a scarf again over the micron so that they're not touching their stoma area directly with their fingers when occluding for voicing.
Yeah, I think
Does that answer that?
Yeah, I think so. And I think, you know, just as you said, remembering the basic rules is hand hygiene, even if their hands go closer to their stoma, if when they get home, they then wash their hands and renew their whatever they had near their airway in the nose and mouth, then they would be as safe as the rest of us. So another question that came in, Alison, is what is the solution to enable patients to exercise more following total laryngectomy? And I know it's not an easy one.
Okay, well, the first thing I'd recommend is that patients wear an HME for improved lung health to reduce coughing and mucus. I'd also recommend that when patients are active, they wear the extra flow to reduce breathing resistance and feelings of shortness of breath. So practicing deep central breathing techniques to allow the lungs to take in more air should also result in patients feeling less breathless. And deep central breathing is also the best way to breathe for voicing with a voice prosthesis. If a patient's breathing is shallow, they'll become short of breath more easily. So wearing HMEs 24/7 should ensure better sleep, and therefore patients will have more energy and stamina for exercise during the day. I think the other thing is to set realistic goals and build exercise up slowly, doing a bit more every day. Also addressing the issue of exercise pre-operatively and in clinics early on in the patient's journey could be beneficial. And considering really whether there's a specific need for sort of more structured exercise programs for patients could again be extremely beneficial for patients, much like the way that there are exercise rehab classes for cardiac patients. So I think a few things together, we can really find a solution to the problems that patients experience.
Yeah, I think we all should be talking a bit more about this with our patients. So we've got a couple of other questions, one that came in during the webinar and one that was previously submitted, and they're both a bit related. So the first one is there anything that can be recommended for vigorous exercise since extra flow HMEs might not be tolerated? And what are the consequences of removing the HME during physical activities?
Okay, well, obviously, 24/7 use of HMEs has been proven to be most beneficial, reducing forced expectorations, coughing, wiping of the stoma area. So we would certainly be recommending that patients wear their HMEs 24/7 for maximum benefits. And the literature, there's quite a lot of literature to show this. So removing the HME, especially when outdoors, opens up the airway to dry, cold and dirty air, and really where anything can enter the airway. If a patient absolutely must remove the HME, I would recommend that they remove it. Take some deep abdominal breaths in and then replace it and try to continue with their exercise.
Thank you, Alison. That makes sense. There's another question about which types of exercises can laryngectomy patients realistically do? And I'll probably answer this one. And I think the key word in this question is realistically. So we need to be realistic. It will depend on the level of activity prior to surgery. And even if the patients want to increase the level of activity compared to what they had before surgery, the key is to progress slowly, do something they enjoy and they are motivated to do. And as you mentioned in the presentation, do it with family, join a club, so they can be kind of, their progress can be monitored. And from my experience, looking after patients post-laryngectomy, exercises such as Tai Chi or yoga are exercises that some of my patients do that include breathing coordinated with movement, and that is beneficial for their pulmonary health and rehabilitation, as well as for the rest of their body. And I know of patients that do long distance walking and hiking, cycling, running, and that will be entirely up to the patients and what they want to achieve. But again, setting realistic goals and expectations, I think, is definitely the key. What do you think, Alison?
Absolutely. I mean, if patients haven't exercised much before surgery, the chances are that after surgery is going to be difficult if they try and sort of take up new exercises. So I think just going really slowly, like you say, and just setting these realistic goals, building up, doing exercise with a friend just to keep their motivation levels up, and also becoming accustomed to the different HMEs for different situations.
Yeah, and I think mental health is so much in everyone's mouth these days, isn't it? And we definitely need to be encouraging activity to address that as well. So another question that I've got here is, what is the evidence to support using HMEs 24/7?
Okay, so several studies have been carried out showing that 24/7 use has optimum benefits. So significantly less coughing for patients, less forced expectorations, less stoma wiping, better sleep and less fatigue. And this having definite implications for quality of life. I can actually send the relevant literature to anybody that wishes to read more about this area, but we definitely recommend 24/7 use for optimum lung health.
We actually just had a comment from Yvonne that says that the research presented could strengthen the need and case for physiotherapists to become essential members of the head and neck teams, and I couldn't agree more, as they can guide on benefits of physical therapy and programs. So seeing programs and pathways of physical rehab from physiotherapists within the head and neck team for patients post laryngectomy or not, I think that would be an amazing thing to see. Thank you, Yvonne, for that comment.
Yeah, I agree with that 100%. Absolutely.
And one last question, and I think you briefly touched on this, Alison, during the presentation, is should exercise post-laryngectomy be discussed with patients in the pre-op counselling phase?
I think absolutely it should be. I think patients need to be prepared for pulmonary issues post-surgery, and also be counselled about the importance of exercise and the benefits to health and mental health, physical health, mental health, and quality of life. And I think, yeah, that absolutely should be included in pre-op discussions and throughout the post-op stages as well. Absolutely. Yeah.
Brilliant. So I think that takes us to the end of our questions. Please, if anyone's got any burning questions, please just type it in and we'll answer it now. If not, then I would like to thank you, Alison, for presenting all this great evidence on such an important subject. And I would like to thank everyone as well that's joined us today. I would also like to wish everyone a very nice evening. Stay well and stay safe.
Thank you.